Good afternoon, everyone, and welcome to today's Reinventing America's School webinar. My name is Curtis Valentine. I'm the co-director of the Reinventing America's Schools project, and I'm your moderator for today. Today's event is co-sponsored by the Reinventing America's Schools project, the 74, and Education Reform Now in Washington, D.C. The Reinventing America Schools project is housed at the Progressive Policy Institute and promotes a model of schools we call 21st century school systems, or systems that provide parents more choice and give schools more autonomy in return for more accountability. Our research shows that in urban America, public school systems that do this, like Washington, D.C. has done so well, produce the most rapid improvement in student performance. The purpose of this webinar is to discuss the impact and significance of the science of reading and its impact on literacy gaps exacerbated under COVID. So let's get started. Before we actually jump into introducing our panelists, we want to survey the audience. We want to know who's out there. So those who are logged in, please answer this survey question. And most importantly, which of these categories do you most identify with? Parent, educator, funder, journalist, advocate, or policymaker? If you're like me, I fit into about 3 of those categories. But on today, as you're coming to this conversation, which category do you most identify with? We'll give the survey results after we have our audience, our panelists, introduce themselves, where they're from, what they do. And so we're going to start with our sister, Dr. Burke. Please introduce yourself to our audience.
Good afternoon, everyone. I'm Kymyona Burke. I am currently the Policy Director for Early Literacy for the Foundation for Excellence in Education. I'm based here in Mississippi, and I'm the former State Literacy Director for our Mississippi Department of Education. Thank you.
Excellent. We're going to come back to the DC metro area, and we do have Dr. Grant. Dr. Grant, can you introduce yourself?
Sure. Good afternoon, everyone. Greetings from the nation's capital. I'm Christina Grant. I have the joy and pleasure in serving as the State Superintendent of Education for Washington, D.C. And so thankful to you all for coming together today to have this critical conversation and have it based here in Washington, D.C. Good afternoon.
Excellent. We're going to stay in the city, and we have Cassandra Gentry. Can you introduce yourself?
Good afternoon, everyone. I'm Cassandra Gentry, and I am a parent lead for education with PAVE. And I am also a grandmother raising a grandchild in the District of Columbia, and also an advocate for grand families. Thank you for having me this afternoon so that I can express what the grand families and grandparents are going through and how this, the science of literacy can help us. Thank you.
Thank you so much for being here. Mary Clayman, also here in the city. Introduce yourself.
Sure, thanks, and good afternoon, everyone. My name is Mary Clayman. I'm the director of the DC Reading Clinic, which is a clinical practicum for teachers of reading sponsored by DCPS, DC Public Schools, and we train teachers while meeting with kids, and we train all throughout the city and DC Public Schools. Thanks for having me.
Thank you for being here. Representative Chang, please introduce yourself.
Thank you. Hi, my name is Allister, and I'm proud to be the first Asian American elected to the DC State Board of Education. And this work is very personal to me. Growing up, my dad was not a proficient reader, and since middle school, I've been helping my family read and translate documents. And I love this work, and I've had opportunities to deepen my work in literacy with groups like Libraries Without Borders, with UNESCO, and the Library of Congress.
Excellent. Thank you so much. And last but not least, Dr. Durant.
Good afternoon, everyone. I'm Dr. Durant. I'm the Chief Academic Officer here at the Academy of Hope Adult Public Charter School. I'm in the district, and we serve adult learners in the district, ages of 18 years of age or older. I'm excited about being here today, excited to hear all the different resources that the district is offering to influence and support literacy amongst our residents. And so I look forward to this discussion today.
Again, thank you all for being here. I'm excited. This is a dynamic panel, an incredibly important topic. So as we get started, we want to put this discussion in context. Literacy gaps by race and income existed long before the COVID pandemic illuminated the dramatic inequities in our public education system. In this post-COVID world, those students who were treading water before are in jeopardy of drowning without the right interventions. Before we drill down on what's happening here in the nation's capital, let's look nationally. Dr. Burke, what did the national data on literacy rates by race and income prior to COVID show?
Well, let me start by giving just a little context to a couple of terms that you guys will hear today. Representative Chang already used one, which is the term proficiency. So when you discuss proficiency as it relates to literacy rates or reading performance, you're really talking about a student's ability to demonstrate that he or she has the content knowledge. They're actually able to apply that knowledge to maybe unique situations, code reads, things like that. And then they're also able to think analytically. So I wanted to make sure that we understood, just kind of have a common definition for the purpose of this conversation about what proficiency really means. When you're thinking about a state assessment, you'll hear proficiency or the percentage of students who are proficient. And that usually relates to how well students are able to master the state's standards as it relates to any kind of content area. So I'll also mention a little bit about scale scores. I'll talk about, as we talk about pre-pandemic, I'll talk about our national scores from the National Assessment of Educational Progress, which speaks in terms of proficiency, but also speaks in terms of scale scores. And those are the scores that are designated to states, and we're able to form trend lines from those scores to really see how well we've performed over the last 10 years, the last 20 years, and they are on these scales that are really representative of what our individual states' proficiency rates may mean, right? So I'm a former teacher, I'm always a teacher, so I wanted to start with a bit of vocabulary. So now let's dig into the numbers. So in 2019, again, you mentioned, pre-pandemic, we already actually had some challenges as a nation, right? So pre-pandemic in 2019, only about 35% of our nation's fourth graders were scoring at proficiency. We'll really look at fourth grade because that is the time where our students are transitioning from the learning to read, kindergarten through third grade, and then also reading to learn, being able to access more complex texts, content areas, subject matters, all of those things. So we're really going to look at fourth grade for the purpose of this conversation. So again, overall, about 35% of our students in the country were considered NAEP proficient. Now let's dig into some of the subgroup data. I think we no longer can mask how well our white students are performing. Our states are performing by how well our white students are performing, right? So when you think about that 35% number, and you think about how white students were performing, white students actually were at a proficiency rate of 45%, right? So now let's look at our Black and brown children. So when we think about how our Black students performed on NAEP, the proficiency rate of Black students in fourth grade was only 18%, okay? And for our Hispanic students, 23%. If you were a student who qualified for the National School Lunch Program, then the percentage rate of proficiency in fourth grade was 21%. So why are these things important? And I know that Dr. Durant is going to talk about this a little bit later, but students who are not proficient readers turn into adults who are not proficient readers if we don't do something about it. A couple of the bright spots from 2019 included Mississippi and also DC. And I'm not going to steal Dr. Grant's thunder because I know she's going to talk a little bit about DC data. But one thing that really came out of the results for Mississippi during that time was that our low-income students, whether white, Black, or brown, outperformed their peers nationally, of course, for the first time in history, right? Outperform their peers nationally. So I'll say this, I said that to say this, that academic achievement does not have to be accredited to zip code. We know what we can do about it. So again, I'm so glad to be here today so we can discuss the science of reading in all of its different forms, so we can actually address these challenges and begin to narrow this achievement gap.
Thank you so much. And I know it's still early and we're still sort of on our way out of the pandemic, but from where you are, what impact did the pandemic, virtual learning, have on the data that you saw from 2019, or what do you expect to see moving forward?
Yeah, so NAEP is the assessment that is administered every 2 years. It was administered in 2019, which means that it should have been administered in 2021. And of course, that did not happen. We do expect NAEP to be administered in 2022, which means that we will have an opportunity to compare apples to apples. But right now, we do have some state level data that has been released from state assessments that were taken last spring. Spring of 21. It confirms what we do know, right? Mississippi has released this data, so has Alabama, so has Michigan. It confirmed what we already thought, which was, again, whether we want to call it learning loss, uninterrupted learning, unfinished learning, all of these terms, that our proficiency rates in English and reading decreased. But what's also just very eye-opening is that for math, it decreased even more. We do know that there is a strong correlation between how well students are able to perform as far as literacy, and that's across content areas, and also, with their performance in math. So what we've seen is that as states begin to release their data, we consistently see this decline, and in some cases it may be 3%, and then other cases it may be 12%, where there has been a decline in reading and reading proficiency.
No, thank you very much. Today's discussion is exciting because it's one of the few times that we as a team really concentrate on a single district so we can dig deeper. And so, Dr. Burke, we appreciate you, but you are the only person on the panel who's not actually from Washington, D.C. I'm sitting right on the outside in Prince George's County, Maryland, but we have a dynamic panel of individuals who are helping lead a city. And so we're going to dig deeper in a way that we often never do. That being said, we do want to come to the newly minted state superintendent, Dr. Grant. Dr. Grant, now national rates make good news stories, but in America, where all policy is local, it's cities and districts where the change happens. So Dr. Grant, tell us about the city you lead and what did literacy data look like prior to COVID?
It's always frustrating. After 18 months, one would think that I can unmute myself from Zoom, yet here we are. Dr. Burke, thank you so much for A, giving us the vocabulary, and B, setting the national landscape. It's fun when I think a bunch of former English teachers get in a room together to talk about literacy. I think that reading is life. Frederick Douglass said that the key to freedom is learning to read. And those are the words that open our comprehensive literacy plan here in Washington, D.C. So that's the spirit with which we enter the conversation. I think what you have heard nationwide and here in the nation's capital is that we are very proud to be one of the fastest improving urban school districts in the country, not just produced by kind of our thoughts, but as demonstrated on the NAEP. In 2019, we showed significant gains in 8th grade reading. We saw an average score scale increase of 3 percentage points. I drilled down further to the notes that were framed for the Dr. Burke and saying that in our park level assessment, overall, 37.5% of our students met or exceeded expectations in ELA in 2018-19. And I think that the framing that was set across the nation is one that we're top and mindful of here in DC, is when we look at all of our subgroups. That was a moment in time where we actually did see an increase in ELA and in math in 2018 to 2019. And we saw our Black and African American students at 27.8 proficiency, but that represented a 3.1% increase in terms of their proficiency levels. I want to be mindful of time and the fact that I could talk about this for hours, but frame that this work that we are really excited and proud of is literally the beginning of an ongoing conversation. This reflects 10 years of focused efforts directly on literacy instruction, making sure that we are aligning our resources with our rhetoric, and it's across all of the wards of the city. We want to make sure that students are engaged and they're joyful. I'll talk more about a classroom that I was in this morning, and all of this has to be grounded in equity and excellence so that all of our children know how to read and all of our children are on the path to getting free.
Thank you so much. And I'm sure the city is so honored to have you. And so the question, I think, and this is actually prior to your tenure, but can you talk a little bit about how COVID impacted literacy rates in the city, particularly as the schools went to virtual learning models?
And so again, as individuals know, DC is unique in that we were one of the only, we believe we are a state. We were one of the only jurisdictions that applied for and received a waiver for statewide assessments. And so this morning I was in a classroom and there were masks and there were plexiglass, but there were also children. And it was a first grade classroom and it was the joy of literacy playing out in front of my eyes. We had a teacher with a puppet who was introducing a book and children were hanging on to her every word. And so it was humbling to see after 18 months, children in classroom learning how to read still holds true. And that is where we are. We, in adherence of receiving the waiver, each of our LEAs in our schools had to produce school level summary data on the assessments that they did give, the goals that they did set for their children, so that we could shift the conversation from learning loss to having a foundational conversation around where are we with our children and where do we seek to go to continue the improvement we've seen. And some of what Dr. Burke said is true in that we are seeing early evidence of math and the learning loss that took place in math. And what you will see coming out of DC soon is the full analysis of what we're calling our local assessment data, where we will produce a summary to inform everyone of like, this is where we are, and these are the roads that we have to travel ahead. It'll be very exciting in DC that we will reintroduce our statewide assessment so that we can continue the conversation. But the reality of where we are is we did not produce a statewide assessment during the pandemic. As a result, we are collecting data from our LEAs on what they learned themselves so that we can align as a system on the path forward. I think that I've covered all of those points and the good Mr. Valentine, let me know if there's a follow-up question there.
No, that was excellent. And we'll definitely want you to dive a little deeper later on in the panel. You mentioned it. I will shout out all the ELA teachers on this panel, myself included, Oxford Hill Middle School, 8th grade language arts, and everyone else. That is, I had an amazing time with my students, but now I'm seeing my students who are, parents now. And so that's a whole nother conversation. Teaching is incredibly important. And so data on literacy rates and literacy gaps speak volumes. We're hearing numbers 18%, even 45% in so-called high levels, which internationally obviously does not rank America well, but it also only tells half the story. The what matters, but so does the how. And some would say we've been teaching reading all wrong, and I've been stopped on a number of occasions. And some folks are kind of stuck in the phonics, hooked on phonics era. But we have an expert in this. Mary Clayman from the DC Reading Clinic. Is that true? Have we been teaching reading all wrong?
Well, the short answer there is it depends where you've been. But there are, following along with Dr. Burke, I do want to define two terms that are really key for understanding how to teach reading. So a term that gets thrown around a lot is the science of reading, and I'll explain that in a second. And then another term that's equally, if not more important, is structured literacy, which is the type of instruction informed by science of reading. So let me first try and define science of reading. So science of reading is this vast body of knowledge, decades of research, fMRI studies, which is cognitive science, information on the English language, the theoretical underpinnings of how we think children acquire print, a vast, very long-term body of knowledge. A lot, and any research study about whether an intervention work would fall into that body of knowledge. And so we've had this body of knowledge for a really long time, definitely since 1990, when we had fMRI technology and the National Reading Panel soon after. So we've had this body of knowledge. The question is whether that body of knowledge is translating into schools. And that's the big question around science of reading. Is the instruction in schools informed by this vast body of knowledge? And so that second term I brought up is structured literacy. And structured literacy is the general accepted term for instruction informed by that vast body of knowledge. And so when we're thinking about, is a school or is a school district or is a teacher basing his or her or their instruction on sound evidence and research and decades of research, we want to ask whether they're teaching structured literacy, whether they are using the techniques and the curriculum that are backed by the science of reading.
And so I guess my follow-up was, how is that structured impacting literacy rates in Washington, D.C.? You're in a school right now. You said you're doing a school visit. Can you talk a little bit more about what your system is doing, particularly in this area?
Sure. I can talk a little bit about the clinic, but if I talk about structured literacy, so what we look for there maybe would be helpful. So structured literacy in the and how the science of reading informs it would suggest that schools that are really drilling down on foundational skills in K through 2. So we're talking about having an adequate screener of foundational skills, teaching explicit phonemic awareness, teaching explicit and systematic phonics, having needs-based groups that address students' specific foundational needs, and then also teaching kind of the other side of the equation, language comprehension. So schools that have a really good foundational block K2, and then are aligning with the science of reading all throughout the day and all throughout the continuum. That's what we're looking for. There's another piece here, which is the teacher knowledge piece, which lets me talk about the clinic as well. And so teacher knowledge is really, we cannot with reading, we've learned this over years and many studies which suggest this, we can't put any curriculum in front of a teacher and expect them to be a master of their craft. There is a huge body of knowledge that I've referenced several times that teachers need to have access to and understand to be able to adequately diagnose and intervene with a student. Like they say, teaching reading is rocket science. So part of this equation isn't just what we put in front of students and like you said, Mr. Valentine, what the how, it's also how the teachers are prepared to do that how well. And it is a vast body of knowledge that teachers would have to know to be masters of their craft, which is part of the challenge.
And I want to talk more about that as well, how we can better do that. But before we move on, I do want to check back in on our previous survey about who we have in the audience and who's listening in. And so can you pull that up? 39% of those who are logged in are educators. So please keep that in mind. And we're gonna be coming to you, Dr. Durant, right now. But you also see another 31% are focused advocates, like you, Ms. Gentry, and others who are saying, this is really important to me. Some of them may be also parents, but those who are saying this is incredibly important to my community, to my family, and just society overall. Having a literate society is the foundation of democracy in a lot of ways. And so, having done that, we want to push out another survey, and this survey speaks more to what Mary Clayman just mentioned. This is sort of, do you know whether your district, school district, or charter network is using science of reading to teach, but also to the point, Ms. Clayman, using science of reading to inform how they're going about teaching? And so this is a yes or no answer, and I imagine it's going to really illuminate a lot to a lot of us. But do you know, are you informed about how your district, how your charter network is informing your teachers of English and language arts? But that being said, we want to drill down to the school level. I mean, we've gone to the national level, the district level. We've talked about sort of the foundations of this, but we want to get inside the school building. And so, Dr. Durant, you know, the impact of parent engagement on student achievement is clear. This idea that, you know, when you can sort of create an environment for your children, it will increase the likelihood of them actually carrying out that particular action. The impact of parent reading levels impact student performance in reading. And so you lead an adult charter school that prioritizes literacy. Why is your school so important right now?
Well, I think just like everyone else said, I think that, you know, as an adult charter school, responsibility to the district residents are on the same playing field, that they're given the same resources and they have the same opportunities. I think adult education is extremely important in this day and age because a lot of the residents of the district are potentially have been afforded less opportunities because of some of their educational levels. And so we want to make sure that the district residents have the opportunity to continue to propel their educational journeys forward, as well as begin to put themselves on the same playing field to be competitive. One of the things that we've realized is that 1 in 5 high school students do drop out of school, which means that those students drop out, and where do they go? You know, a lot of the learners that we get that come through our doors, they don't have a lot of the same opportunities because they have decided that education wasn't for them when they were younger. But when they become older, you know, they realize that this is something that I want to do. This is a new journey that I want to tackle and I want to embark upon. So should we shut our doors on them? Should we allow them to not be afforded the same opportunities because they decided a long time ago that they didn't want to continue their education? And so what we're doing is we're allowing for learners to be able to gain their credentials, to be able to be pillars in their community. So that not only are they supporting themselves when they gain these credentials, those learners are supporting their communities, their families, their children. We know that within the household, there's 72% of the students that come to us from families that parents who do not have a high school diploma or education also have a deficiency in reading and literacy levels. And so that's important for us to make sure that those parents can be able to support their students, but also be able to be in a position to where so they can help their students believe in themselves and understand the importance of always being great readers. One of the things that at Academy of Hope that we pride ourselves in making sure is that we don't want this to be an or conversation. We want this to be an and conversation because we're not a separate structure. You know, because what we do here not only impacts not only the student, but it also impacts the whole community and the families. And so I think we're doing such great work over here that's not only allowing for our learners inside the doors to be benefiting from the resources that we're providing, but when they go to the communities and they realize that this is something that I've done, and now it's helping our communities see the resources that they're bringing to the community to become better citizens for the district.
No, thank you for that. And I want to dig a little deeper. Can you speak to how a student will matriculate through your school compared to a traditional high school, specifically because you are concentrating and really emphasizing this idea of literacy? So can you get a little bit more specific to those who are listening, saying, how is this school different from where they would get a traditional school?
Well, in a K-12 setting, what you're trying to do is you're trying to educate the whole child, right? What we're doing in an adult education setting is we're trying to educate the whole community. And so we're putting ourselves in a position that will be able to support the community by giving them residents that are effectively able to communicate, that's able to support their families and able to believe in themselves, because we know that when you have higher literacy levels and you are in a position to be able to gain different levels of certification, when learners walk through our doors, we provide them with an opportunity to gain either a GED or an NED diploma, but the buck doesn't stop there. What we do is we also provide work-study credential programs that allow learners not only to be able to gain stackable credentials after they leave our GED programs, our NED diploma programs, because we know that that's not just enough all the time. Our learners come in sometimes with challenges that they don't even know that have not even been identified. So we do post and pre-testing to make sure that we are placing them accordingly to where they can be successful. Those credentials that we do provide to our learners give them an opportunity to not only become educationally advantaged, but also economically advantaged. And so when they go to the community, they are now equipped to have those credentials to be able to say that not only have I gained an opportunity to become more educated, but I also gained an opportunity to be competitive in the workforce, because I know that just having an education alone is not going to give me what I need to be successful in life. And so we make sure that we are giving our learners that holistic wraparound services. And so like I started from the beginning, as a K-12 setting, you're educating the child. But at an adult education setting, what we're trying to do is educate the whole community to make sure that those learners know that what they provide to the community is going to be a wraparound service to everyone to benefit from.
At the outset, I highlighted that our project has done research and has tracked school districts that offer school and school leaders like yourself more autonomy, and folks will say traditionally in a charter school setting, you will have more autonomy than a traditional public school in a traditional district. So can you talk about any additional autonomy freedom you have as a charter school to do the work that you do and what that looks like?
I think as a charter school in itself, we pride ourselves on making sure that we're meeting the learners where they are, which means that, we're building our curriculum around how to support the learners, not only, not necessarily what it is that they're going to need inside the classroom, but what they're going to need outside of the classroom. So we're working on, like Dr. Burke spoke on, we're working on those 21st century skills. Those learners, when they leave us, they have to have other skills that's going to allow for them to be successful. And so while we want to pride just education, reading, math, but there's so many different applicable skills that they need in order for them to really navigate and be successful in the world. And so what we do is we develop our curriculum and our standards around making sure that we're providing, like I said, that full wraparound service to our learners. And so when they walk through our doors, they know that they're not just getting a standardized curriculum, they get a curriculum that's pre-prescribed for them to be successful. So when you come at different levels, it does not matter. We're going to work with you at that level, because we know, like I said, we have 1 in 5. So that means that when the learner comes into our school, that learner is coming into our school at a disadvantage in itself, because they have so much learning loss. They have so many years where they have not paid attention to wanting to be in a classroom setting. So we have to be able to meet them where they are. And so when we make our curriculum and our courses more relatable, and we also make sure that they understand that this is not a race to the finish line, it's just making sure that you get there, because there's no set time. And so, but what we make sure is that because of our post and pre-testing, is that the learner, when they walk out of the door every semester, that we know that they have learned something. And when a learner knows that they can see gains in their development, they're more applicable to want to continue the process. And so we want to make sure that they see those learning gains every semester, because everybody's going to perform at different levels.
No, that's amazing. Thank you so much for, again, giving us that information. Before we move on, we do want to push back out the results of our latest poll. And this is sort of asking parents, how much do you know about your own district and how they're using the science of reading to inform teacher training, curriculum, and the like. And so about 46% said yes, 54% said no. So it's there's a difference, but not dramatic. And so for those who are informed, great. For those who don't know, these are things that we want you to do, to ask your school district, your school leader, those officials, to say, how is the science of reading informing the work we're doing in our district? Ms. Gentry, you saw the poll. The majority, the largest constituency of folks on this call are parents. And so the idea that, let's talk about the role that you as a grandparent and other parents play in their child's education. We just heard from Dr. Durant saying, he's on the one end really trying to ensure that those parents in the home are literate. But you also, during COVID, were very involved in their child's education. I said during COVID, parents, grandparents, guardians had to become, in many ways, reading instructors, oftentimes patching together a curriculum for their children and grandchildren and those who they were taking care of. And so, Ms. Gentry, tell us about your experience and the experience of other parents at PAVE prior to COVID and during the pandemic.
Thank you, Mr. Valentine. Dr. Durant, that was very interesting what you were talking about as far as the parents, because that is one of the experiences that we went through during the COVID. A lot of us, we got the children and we had to go on the virtual learning, and we were not able to assist our children in the way that they needed to. So even though there was a loss before the pandemic, and we're saying that 30% of our fourth graders were not proficient, and then during the pandemic, they're left with parents and grandparents that cannot help them to get through that. And so now the rates are lower. You know, we have a higher percentage of children going back into school that are not ready. I have a fourth grader. She was a fourth grader last year, fifth grader this year. She wasn't proficient last year. And after 19 months, she has really lost a lot more. I was not capable, we weren't able to have tutors and things come in until a latter part. So the science of reading is really important to us. When I received her, she had not went to kindergarten or first grade when I took her guardianship. So she did not learn the basic fundamentals that she needed in order to be proficient. Now it's like she's still struggling because of that. So one of the things that I've noticed about the science of reading is the early childhood intervention. And that is so important. When Dr. Grant was talking about she had visited a first grade class, that is the beginning. But pre-K and kindergarten, this needs to be introduced during those times to assist with the children when they get those fundamentals early. It does help them to go through. Even with the reading clinics and reading partners, all of those are things that need to be incorporated into these children's learning and into the schools during the pre-K and kindergarten. So when they get to first grade, where Dr. Grant was at today, they are working toward being proficient. It shouldn't be that they start working with them then to get them ready, and then they're still behind in the fourth grade. So that's one of the things, that's the experience that we've had before and after this pandemic. And it's been a struggle for some parents. It's really been a struggle.
And what are some of the lessons that you and other parents have learned? And more directly, what is PAVE doing to really ensure that parents like yourself are prepared to support their children, those they guard their guardianship of?
Well, we have been out and we advocate and we are talking to our local officials to get the right programs into the schools, and not just into some schools, but all of the schools. We need equity. My school doesn't have reading clinics. They don't have reading partners. So the Reading Partners program, it goes to certain schools, I guess, where they feel like the need is, but the need is all over. Our children of color and our Hispanic children are in need of these resources also. And maybe they go to a school that has a higher percentage of Caucasians, but they still need those programs. So this science of reading is going to have to be equitable. It's going to have to be where it's spread across, and that all children have the opportunity to get this instruction. All of the children are going to need it.
No, thank you for that. Thank you for all that you've done and will continue to do in the district. Unfortunately, we have policymakers, we have district leaders right here on this conversation. We're going to have these discussions just today. And so, in education, policy drives practice. And fulfilling the mission of the State Board of Education in Washington, D.C., it said, is to be shared. It's a shared responsibility whereby it engages families, students, educators, and community members. That's the mission. And so, Representative Chang, you've developed award-winning literacy programs. What have you learned about what we've gotten right and what we've gotten wrong?
Great, thank you. I want to start by agreeing with Dr. Durant that we have to be doing more to meet families where they are physically, socially, and emotionally. In my work, I've had opportunities to extend literacy programs to spaces like barbershops and laundromats, and to weave literacy programs into the daily rituals and patterns of people's lives. That's where I've seen the greatest impact. Some people say that if you build it, they will come. And I don't think that's enough anymore. No matter how evidence-based or effective the pedagogy, if people can't show up, can't afford to miss a shift to be there, right? It's not going to lead to the impact or outcomes that we want to see. And so making literacy programs available is one thing. And I think that making literacy programs accessible is another thing entirely. We have to be doing more to prioritize how we make literacy resources accessible. I also want to propose that we learn more from our colleagues in healthcare. So they're currently investing more and more in what they call social determinants of health, right? So 2018, Kaiser Permanente invested $200 million to take on housing instability, knowing that that investment would actually reduce their healthcare costs downstream. Let's advocate for similar funding to be invested in what we can call the social determinants of education.
What are the greatest obstacles, do you think, to scaling the very interventions and solutions that you just proposed? This idea of, how do you scale success of the research-based ways of teaching reading that Mary mentioned before, as a policymaker of a district, but in many ways nationally?
So one thing we're seeing, I think, is the importance, and this is a very structural macro level piece, right? That doesn't have a very simple answer, but leadership turnover and teacher turnover are so high in this work. And when I look at, for example, what Mississippi has done well, Carrie Wright, the state superintendent, has been there since 2013, and we've seen increases in scores the longer that she's actually stayed in that position, built trust, built relationships. And I find that to be a really important piece of the work that, doesn't have a very silver bullet answer, right? And similarly with educators, right? Their plates are super full, and I'm a huge fan of what Mary Clayman is doing with the DC Reading Clinic, and find it always amazing. And when I talk to reading instructors in DC, they all want to be a part of the DC Reading Clinic, which is an optional addition to add on to their plates. But I don't think we can keep expecting educators to take more and more on without providing additional resources to help take other things off of their plates while we're asking them to take on more.
Thank you. And you segue into sort of a conversation I want to have as a panel, and that's resources. For those who are following, we have had historic injections of resources into states and school districts post-COVID. And we're having conversations about how to spend those resources, how to allocate those resources to have the greatest impact, but also ensure that the allocation is, to Ms. Gentry's point, equitable. Those who need the most get the most. And so recent federal legislation has injected historic amounts of funding, as I mentioned, and this in many ways is to address so-called learning loss, interrupted learning, and the like. So to the entire panel, how should districts, how should states be spending this money to address these gaps that we've been talking about since we joined the panel? Anyone can jump in there as well.
I'll
How
start.
should we be spending that money?
Okay, I'll start. I've said this many times before, invest in people, invest in your teachers, build their knowledge, empower your teachers to stand in front of children every day and know that they are skilled enough to address the different needs, the different deficiencies or challenges that students may bring into those classrooms. And I think that for Mississippi, we had a statewide approach to professional development in the science of reading. We blasted the state beginning in winter 2014, and we continue to train teachers and administrators. Today, we've continued with our science of reading training, and I just believe that is one of the biggest and boldest investments that they can make with their money right now, is to ensure that those teachers are prepared to teach children how to read.
Mm-hmm. Invest in people. Anyone else?
I go really quickly. I'm being mindful of time. I think it's two things, but I'll speak specific to DC. One, it's not ESSER related in that we have recently received a $60 million grant from the United States Department of Education, just focused on comprehensive literacy and the development of our statewide plan. And so those resources, I'm excited, will literally be targeted on this initiative and this great work to help us understand COVID, but also help us address the realities that existed before COVID as we think about literacy. The second part, which is a part of our investment, really is on the importance of tutoring. And Ms. Gentry referenced it briefly in her remarks. Part of what we're seeing from the data, regardless of the gap, is we actually have to have supports that are tailored to the student. And so when we talk about the science of reading or the nuances that those of us who are English teachers know, it literally is having an adult and an individual to sit with a child where that child is at and go through that process. And so we're excited about standing up a $41 million investment that is just on high impact tutoring. And the uniqueness of the model is it's both and. So the resources will be dedicated to schools, but we will also be standing up grants so that community-based organizations, libraries, churches, organizations that are in the community doing the work of children can have both, right? They can have targeted supports, teams of individuals who can teach them the art of tutoring, but also have it be stood up in their actual community. Because we are going to have to get our children before school, during school, after school, on the weekend. And again, it can't be grounded in something that children did not cause. It has to be grounded in a reality of literacy is critically important to your life. And we, the adults, the policymakers, are going to put the resources in alignment with where we know our children are and where we know they can get to, regardless of the state of our global health in all of our issues. And so we're excited about our work to continue this conversation forward so that 10 years from now, these numbers will have doubled and we'll be talking about the power of literacy and not just like the critical needs of literacy.
That sounds like an ecosystem. And Representative Chang talked about barbershops. Dr. Durant, you and I don't go to a barbershop as much as we used to, but the idea that you could go into a barbershop or a beauty salon or where you are surrounded by, you actually create this network around our students is amazing. Ms. Clayman, you came off mute. Did you want to say something?
Yeah, I just wanted to bring the through line that exposure is not enough. And I think Dr. Burke and Dr. Grant were getting to this. The training of the teacher is fundamental. Without that, the student and the teacher next to each other, we're not going to see the gains. And until we as a country really reimagine what it means to be a reading teacher, do we need the same type of training as a pediatrician? Maybe not that much, but we need really intensive, high-level intellectual training to be able to meet the needs of kids. And until we reimagine that and have structures in higher ed, post-secondary ed, within school districts to train those teachers, we aren't going to see the results. It's a really high level of training to meet the needs of every kid and the promise we make to children that we will teach them to read.
Ms. Gentry, I saw you to come off of mute as well. Did you want to add, how should we be spending that money coming into the city?
Yes, and training is very, very important. And I echo Dr. Grant and Dr. Burke on that. Our instructors, they need to know how to meet the children where they are. We have children that have special needs, and those special needs need to be identified, because then they need a more structured program, or they may need more than just the average child. And if the instructors are not trained to identify these differences, then we cannot meet that child where that child needs to be met.
Thank you so much. And in the comments, those who've been watching, there have been references to the rates of dyslexia, identifying it and showing we are meeting the needs of our special needs students. And so we definitely want to make note of that. Dr. Durant, you were going to say something?
Yeah, I was going to, it's so refreshing to be able to hear what everyone was saying about basically having those opportunities, right? And I think in adult education, we have a different lens, right? And so we, at Academy of Hope, we focus on the BASE model, which is bridging academic and social experiences, right? And so those social experiences are the things that our learners bring to the table every day that they have to battle before they can even step foot into the classroom. We know we're dealing with homelessness, we're dealing with food disparities, we're dealing with lack of transportation, we're also dealing with childcare issues. And so all of those resources are needed, especially when you want a person to be able to be committed to education, right? And so I think that having all of those resources is so refreshing to be able to hear people speak and understand how the impact of the lack of those resources from the parent perspective will have an adverse effect on the child when they're trying to come to the classroom to be able to learn the next day. And so I think that having those opportunities for those adult learners to be able to address some of those challenges that they face every day ultimately put them in a better position when they are trying to be able to negotiate their experiences in our program and in our classes. So
Representative Chang, did you want to?
Extremely important.
Sorry to cut you off there. Representative Chang, did you want to add how should we be spending these resources based on the research that you've done and the programs you've been awarded?
Yeah, I agree. We have to be investing in, I love what Mary said earlier about reading instruction being rocket science. We have to be investing in our educators in this way and investing in people. I also think we need to be spending these funds in ways that invest in the long-term capacity of our system, right? And for this, I've been looking a lot at what Malta, the country of Malta, has been doing. And I've never said this before, but to me, they're kind of the Mississippi of Europe, right? Having really jumped up in literacy outcomes in the last 10 years. And one of the main things that they've invested in is a more coordinated approach, right? Connecting the formal sector with informal and non-formal literacy learning opportunities, more coordinated approaches with public libraries, for example, and community-based organizations, right? And I find this actually new influx of money as a really interesting time for us to be breaking down those silos and having everyone move behind what I think, as a great comprehensive literacy plan in DC, bringing additional stakeholders together to get behind the comprehensive literacy plan together.
We have about 8 minutes left, and I want to come to you all for some final thoughts, but I want to make one correction, and this is on me. I've been referring to Washington, D.C. as a district, and it is not a single district. I see Dr. Grant looking at me like, we have DCPS, which is run by Chancellor Farabee. You have a charter school board and a network there, and we have over all of that, Dr. Grant, and we have Representative Chang of the state board. And so Washington, D.C. In this unique structure, again, has had so much success and has made the biggest leaps in the country from where the data at our project is really highlighting. And so Washington, D.C. is unique that it gives parents tremendous amount of choice as well in where their students attend school. But it also, especially charter schools, gives school leaders a higher level of autonomy in staffing and budgeting compared to other school leaders. And so in final thoughts, and I want to go around, speak to your counterpart around the country. So to you, Ms. Gentry, talk to those parents, those grandparents, those guardians. Dr. Grant, talk to those other state superintendents, Representative Chang, those state school board members and local school board members, Dr. Durant, those school leaders, Dr. Burke, those who are looking at this work from your perspective, and also Ms. Clayman, those who are in districts really on this work. What advice do you have for your counterpart around the country about how to close these gaps moving forward. So from today, we want to leave people with something to go on. What should I as a parent be doing? What should I as a school leader? What should I as a policymaker? What should I as a system leader be doing? And I want to start with you, Dr. Grant. You know, what should your counterparts, whether it be district superintendents or state superintendents, be doing moving forward around this work?
I thought you were calling us a district because we're on our way to being the 51st state. So all is forgiven in the District of Columbia.
Thank you for the save. Thank you for the save, though.
And I think, you know, across all of our LEAs in the work, the answer is we are all in this together. So, you know, one of the reasons we ground ourselves in national performance that Dr. Burke so referenced is because our country is only as good as our most literate person, right? So in DC, we are focused on working in partnership with all of our schools to actually ensure that children are exposed to different types of genres that are culturally relevant, that teachers have the best practices available. I could have talked for hours about our educator preparation programs. I have a master's in teaching of literacy, right? Not just in education. And that is why you can bring a different tone and level of excitement around the science of reading, because it is science. Phonemic awareness is very different than vocabulary instruction. Someone standing in front of our children teaching them need to know the difference in both. And so, you know, at this level, we have to make sure that our resources and our priorities are all in alignment of ensuring that our children are learning and being taught in the best ways that make them love reading. I'll end where I started. When a child's face lights up at the sight of a book, you know that you are on the journey of transforming that child's life. And that is the work that we have to do in the district. But I also would argue, given where we are as a country, we actually need to step back and do it as a nation.
Thank you. Dr. Burke, folks who are sitting in seats like yours around the country, what should they be doing? What advice do you have for them?
Yeah, well, as policy people, you know, we always say that we don't want to have to legislate everything, right? No one wants to have laws on everything. But when I think about literacy, you know, my response to that is that a literacy law is an equity law to me. Some of these things that we're discussing today, you know, as Ms. Gentry referenced, these things are already happening in our higher performing, higher income areas and schools. We want to make sure that these things are happening everywhere, regardless of where students are, regardless of income, that they also have access to teachers who are trained, access to being administered a universal screener 3 times per year to know where they are so that we can address their deficiencies. We want all students to have access to these things. And fortunately, unfortunately, depends on where you want to look at it, some of these things have to be put into law in order to do that, in order to make that change for the entire state, to be able to move the state forward. So I'm always here to assist states that are doing that. And that's just my take on what policymakers should be focused on right now.
Thank you so much. Ms. Gentry, what should parents, guardians, advocates from around the country be doing moving forward around this topic?
Well, as parents and our voices, we should be using our voices. First, we need to know what our policies are and know our policy makers, and then use our voices to get what we need. We need to approach them, and if we have to write them, if we have to email them, whatever our needs are, we need to let them know what our needs are, and that we're not going to back down until we get the needs that our children need. We want them to be successful, and we need the help of our policymakers and our teachers and we need our community to help us to make sure that all of our children are successful. So I would say the best thing for us to do is to use our voice. Come together as parents and use our voice. As parents and our voices together, we can be very powerful.
Thank you so much. Mary Clayman, what should specialists like you in districts be doing right now?
Sure, and you asked me to speak to counterparts. There need to be more counterparts. There need to be more teacher trainers. So I think that what I would say is we have the research, and many people are doing great research in their institutions. We have many curriculum, we have many screeners, and we definitely have the kids. The lever here is whether the teachers have the research to back their curriculum. The lever is teacher knowledge and investing, like Dr. Burke and Dr. Grant said, investing in our teachers and totally reimagining the level of expertise needed to teach a child to read.
Thank you so much. Dr. Durant, what should school leaders like yourself be doing around the country to address this issue of literacy?
I think as school leaders, the first thing is we have to lead with a passion, right? We have to have a passion for the work that we do. I think it's important that we also utilize the resources that we have. I mean, a lot of school leaders don't understand the different resources that's around to them. So lean on your colleagues and making sure that you understand what your district is offering to your learners and making sure that you're tapping into those resources to make sure that everybody is able to understand what it is that you're bringing to the table. And so I think it's just very important that, especially for right now, is that you have a passion for what you do and that you really believe in the learners. You believe in those young people and adults. And when you do that, you'll see that it all falls into play, because a lot of times they just need confidence and they need that extra boost from you as a school leader and your staff when their morale is low, to bring them up to where they need to be so that they can continue to do the work that we know is so important, and as educating not only our youth, but also our adults.
Thank you so much. Last but not least, Representative Chang, history-making Representative Chang, final words.
Yeah, I want to first echo what Dr. Grant said about the love of reading, and I'm thinking back to a program I got to see in action recently in DC, which is the Dollywood Foundation's Imagination Library, which was implemented here in DC with the DC Public Library, and the importance of having grade level and being in a literate rich environment, right? And the love of reading that can be fostered by our library system. To the other elected Board of Education members, my advice would be short, which is to ask more questions before proposing answers.
Thank you all so much. I just want to inject one name, Miss Baltuck, my 5th grade teacher who worked with me during lunch. I was reading 3 grade levels behind in the 5th grade. And she took time out of her lunch break to work with me. And so we want to say God bless all of our educators who are pouring into your students. What you do is so important. I just wanted to say her name. Thank you so much, everybody, for joining us. Please tap into what's happening in Washington, D.C. Such amazing things are happening. Check on Academy of Hope, the D.C. Reading Clinic, D.C. PAVE, the State Superintendent's Office, State School Board, Education Reform Now. Thank you for co-sponsoring that with us. We thank you so much for what you've done and what you will continue to do in the nation's capital. You all have a great afternoon. Thank you for joining us today.